Visiting with us now is Dr. Andrew Sandler. He is the CEO of Abe's Garden, which is an Alzheimer's and Memory Care Center of Excellence in the Nashville area. And thank you so much for your time, first of all. If you don't mind, Dr. Sandler, tell us about Alzheimer's and dementia, if you can define them, please.
It's amazing how many people I run into who have trouble with those terms. Dementia is a general term that describes somebody who's having difficulty and a loss with their cognitive functioning. But dementia is not a disease. Alzheimer's is a disease. Alzheimer's is the most common cause of dementia. But there are other causes of dementia where where there's a cause that somebody can get help with. For example, depression and medications and thyroid problems. So what's really important is that people get help as soon as they're noticing that they're having a problem with their cognitive functioning so that they can address those functionings, those problems.
If you can, Dr. Sandler, talk a little bit about who these diseases usually affect.
As a person gets older, they're more likely to get dementia. In fact, almost half of everybody who has dementia is over the age of 85. You're also more likely to get dementia if an Alzheimer's disease if you have a brother or a parent who has it, so there's definitely a genetic component to it. And of course, cardiovascular disease is the common cause of vascular dementia, which is the second most common cause of dementia.
All right, so we're talking about the elderly population who's primarily affected by this, but the younger generation, when we think of early onset, tell us, Dr. Sandler, who that would be. I mean, at what age they may experience early onset and what early onset is.
Alzheimer's is not an old person's disease. In fact, 5% of everybody who has Alzheimer's is under the age of 65. But that is just so devastating because of how early in age the person is getting the disease. It's hard on the person, it's also hard on the caregiver. And because of how long that this could go on, there's a bigger genetic component for people who have an early onset.
Let's talk specifics now. When we talk about, risk factors for Alzheimer's and dementia, tell us maybe in your mind if you have a list of what those would be.
Well, people my age often joke and think that they're getting dementia or Alzheimer's because they can't remember something or when they misplace their keys. I think we do it because we're kind of nervous about it.
Yeah.
But actually, that isn't a problem. The risk factors are when things happen more frequently. For example, when memory problems get to the point where you are misplacing things frequently, or when you keep asking a person the same thing over and over again. Other risk factors are changes in mood, changes in your behavior, when you misplace things, when you have trouble finding words. For example, if you can't say the word umbrella, but you describe it as something that keeps the rain off of you.
I see.
Disorientation to time and place. Those are some of the things where if you're seeing those, you probably should see a doctor and try to see what's going on.
A lot of people may not even recognize that they themselves are doing this sometimes. I know that exists in families. So obviously it's important for family members to rally around these folks too, and if they notice it, obviously get this person to the doctor. I mean, when it's repetitive, like you said, and just reiterating this for folks who are watching the program today, it's a redundancy thing. So if somebody themselves are doing this kind of thing, they don't know to go ahead and reach out. If you notice it in a loved one, should you pick up the phone and call the doctor?
Yes, you should. And the other thing that's important is that if a person gets a diagnosis, it's really important to also tell other people that they're having a problem.
Very important.
Because over time, a support system is just really crucial. So a good dialogue is important, and it's important to learn as much as you can about the disease because knowledge is power.
Absolutely. We know certain ailments affect women, men, children, maybe different racial backgrounds, but when we're specifically talking gender, do more men have Alzheimer's or more women?
Well, actually, women kind of have a double whammy. Number one, they are almost twice as likely as a man over the age of 65 to have Alzheimer's, but also because women are better caregivers, they're also twice as likely to be the caregiver, and so the person's going to have to take care of somebody with the disease. So it's very difficult. It's very difficult.
You mentioned once somebody is diagnosed with this, the good foundation, the support system is essential. How should somebody prepare who is going to be a caregiver of someone who's been diagnosed with Alzheimer's or dementia? How should they prepare themselves for this task?
Well, again, I said knowledge is power. Learning as much as possible, talking to the doctors so you have a good understanding about the diagnosis, and also a good understanding about what the future lies ahead of you is real important. Probably the biggest variable about quality of life for someone who has a diagnosis of Alzheimer's is the caregiver, because this person's going to be needed, they're going to need to be helped by this caregiver all the time. And it's important that the caregiver sees the person as not a disease, but as a person that has a past, they have knowledge, and they have a future. Because somebody who has Alzheimer's may not remember what's going on at the present, but they have very significant memories about emotional events and memories about things that they did a lot of the time throughout their lives. For example, they'll remember songs, they'll remember religious events, they'll remember prayers. These things that they did over and over again, like us riding a bike, never leave them. So it's really important for the person taking care of them to see them that way. The other thing that's important is that the patient is empowered as much as possible to be making decisions about their lives, and that should happen in the very beginning. It's really crucial, because before the person maybe loses their ability to talk or make good decisions, so they can make end-of-life decisions.
Sure, very important.
But then as it goes on, as you and I, we all have the right to make choices about things that we want to do every day, the things we enjoy, when we want to eat, what we want to eat, when we want to take a bath. And that's as true in the beginning as it is when someone goes into a residential community. Unfortunately, they don't always have those kinds of choices in a residential community.
Let's talk just briefly, too, we only have about a minute left, about treatment options. Is there treatment for Alzheimer's?
Well, there's certainly lots of medicines given for cognitive problems.
Okay.
Unfortunately, there's too many medications given for behavioral problems, psychotropic medications with bad outcomes. There's so many good interventions and behavioral approaches that you can use to really help somebody live with a dignity and with choice. And the key is knowing that person and realizing that all behavior has meaning, and really trying to see what's causing the behavior. I call them, I don't like the term behavior problems. They're not behavior problems. What the behaviors that sometimes people see are symptoms, but they're not the behavior. That's not the problem.
Yeah, and obviously there's so much more to learn about Alzheimer's and dementia, so it's probably a good idea for folks who are going to have to deal with this kind of thing with a loved one. As you said, knowledge is power. Educate yourself, you'd probably say, to make sure that they know everything to expect of what life has in store for them.
Exactly.
Right? All right.
So important.
All right, Dr. Sandler, thank you so much for your time. It was a pleasure visiting with you today.
Thank you. I
Great
really enjoyed it.
information.
Thank you.
Thank you.